Hey everyone, and today we're going to be talking about tuberous sclerosis, also known as TSC.
So first I'm going to be talking about cause and diagnosis. Tuberous sclerosis, also known as TSC, is caused by a mutation in either the TSC1 gene, which is found in chromosome 9 and accounts for 10 to 20% of patients, or a mutation in the TSC2 gene found in chromosome 16 and that accounts for 70 to 90% of patients. So to diagnose someone with tuberous sclerosis, you can look at either of these two genes, and if there's a mutation, then it is a definite diagnosis. Another way of diagnosis is through the criteria. So if a patient fits 2 or more major features, or 1 major feature and 2 or more minor features, that is also a definite diagnosis. And in this case, the criteria features is referring to the characteristics and symptoms. So first, I'll be going through the major features in the criteria. Skin. So there are 4 features that fall under this category. There are hypomelanotic molecules, which the photo of which is found on the furthest left on the screen. These are patches of skin that are lighter than the surrounding skin, and they have to be at least 5 millimeters in diameter to count. And there's also a shagreen patch, which is found in the middle of the screen, and it's usually on the lower back and is essentially just bumpy skin. And then there's ungual fibromas, which are flesh-colored papules around the nail bed, and this is found on the upper right corner of the screen. And there's angiofibromas, which are benign, non-cancerous tumors, which appear as small red bumps and are usually found on the face, specifically the nose and cheeks. Next, I'm going to be talking about the characteristics and symptoms that affect the central nervous system. As seen in the diagram on the right side, you can see that the central nervous system is in red, so that's the brain and the spinal cord. So again, these are the symptoms that affect the brain and the spinal cord. So first, there's cortical diaphylaxis, which is when the top layer of the brain isn't properly formed. And then there's subpendumal nodules, which are brain lesions and typically benign, and they can generate into the third symptom, which is a subpendumal giant cell astrocytoma. So some of the other symptoms and characteristics that fall under major features are cardiac rhabdomyoma, which affects the heart. It's a non-cancerous tumor, and it can interfere with the way the heart works. And basically what it does is it blocks the flow to vital organs and causes an abnormal heart rhythm. Then there's lymphangioliomatosis, which affects the lungs, and it's caused by an abnormal growth of smooth muscle cells, and this eventually leads to the formation of holes and cysts inside the lungs. And then there's multiple retinal hamartomas, and which affects the eyes. And then there's angiomyolipoma, which again is a type of tumor, except this time it affects the kidneys. A photo of this tumor is shown on the right side of the screen. As you can see, there's the kidney, and then there's something attached to it, which is a tumor. Next, I will be talking about the minor features. So the characteristics and symptoms that affect skin and oral cavity, which fall under minor features, are confetti skin lesions, which are white freckles. And then there's dental enamel pits, which is shown in the photo on the right, and it's little holes in the teeth. And then there's also intraoral fibromas. Some of the other features are multiple renal cysts, which affect the kidney. This is shown in the photo on the right. In the photo, the left kidney is a normal, healthy kidney, and the right kidney is a kidney that is affected with renal cysts. There's also retinal atromic patches, which affect the eyes, and non-renal hamartomas, which affect other organs. Some of the other characteristics are that 40 to 50% of patients also have autism, and 85% of the patients also have epilepsy. Generally, tuberous sclerosis is described as having non-malignant tumors or hamartomas growths throughout the body. And as shown on the photo on the right, these tumors generally appear in the brain, eyes, teeth, skin, heart, lungs, and kidneys. So now we're talking about inheritance. Tuberous sclerosis is dominant, meaning you only need one allele for the trait to be affected, and on the screen is a photo of a pedigree of a dominant inheritance. Now I'll be talking about incidence. So approximately 1 out of 6,000 people in the US are affected, and 1/3 of cases are inherited, meaning someone's parents had them and they got they got tuberous sclerosis from their parents, and 2/3 of cases are de novo mutations, which are new mutations, meaning their parents were not affected and they are.
While there are no permanent cures for tuberous sclerosis, there are various treatment options that help manage specific symptoms or abnormal cell growth. For instance, renal angiomyolipoma treatment works by blocking the rapamycin protein, which is responsible for cell growth. This and many other forms of selective immobilization block specific blood vessels to lessen abnormal cell growth. This reduces tumor growth, prevents hemorrhage, and maintains kidney function. Another treatment includes nephrectomy, which refers to the surgical removal of tumors. There are also various therapeutic options, such as everolimus therapy, which basically reduces the blood supply and reproduction of abnormal cells. Drugs, such as sirolimus, can also be taken to prevent organ transplant rejection. If you take a look at the graph on the left, it showcases the various treatment options used over years. It is evident that the use of everolimus therapy, transplants, and immobilization increased drastically since 2009. Induction of autophagy or oxidative stress, which is basically the elimination of TSC deficient cells, also works very well in the treatment of tuberous sclerosis. In severe cases, surgical intervention is recommended. So for example, if someone suffers seizures due to tuberous sclerosis, also known as TSC, an epilepsy surgery may be suggested, which is a surgery that removes an area of the brain where seizures occur. While these are some of the treatment options, it is crucial to remember that different symptoms demand different evaluation and management according to the patient's needs. The graph on the right side shows us the outcomes of epilepsy surgeries for tuberous sclerosis patients. The blue bar represents the current status of the patients, and the outcome of the surgery is measured by Angel Epilepsy Surgery Outcome Scale. So, Class 1 on the graph means seizure-free, and Class 2 means almost seizure-free. As you can see, most surgeries were successful in completely stopping the seizures. There are many different related careers when it comes to tuberous sclerosis or TSC. Whether it's diagnosis or treatment, these careers take place in various fields of different subjects. So some examples include neurologists, cardiologists, nephrologists, psychiatrists, social workers, educational specialists, and genetic counselors. Professionals like these get involved based on the needs of the specific patient. Now I'm going to talk about conclusions and connections we can make about this genetic disease in terms of science, technology, society, and environment. However, I'll be focusing more on science, technology, and society. Firstly, tuberous sclerosis is significant in science because of its contributions to our understanding of neurologic management. For example, it has been discovered that Down syndrome and Fragile X syndrome have been linked to TSC. Such findings in neurology and genomics have contributed greatly to science. It has also been discovered that overall, 66% of the TSC population reached the clinical threshold for at least one psychiatric disorder, such as ADHD and anxiety. Other findings in the science world have shown us that the family history for TSC was noted in 25% of patients. Scientific studies regarding tuberous sclerosis are continuously being researched. Now, the scientific conclusions and connections relate a lot to societal connections. Patients with tuberous sclerosis often struggle with behavioral conditions, which may prevent them from meeting environmental and societal demands. One connection that can be made is that more accommodating services are available in today's society to help individuals who are diagnosed with TSC. In terms of technology, tuberous sclerosis has definitely re-evolutionized and enhanced our understanding of scanning and imaging techniques such as MRI, ultrasound, or computed tomography, which helps locate abnormal cell growth. For instance, tuberous sclerosis has helped us understand that MRIs are much more accurate compared to ultrasounds because fat port lesions can be missed on ultrasounds. The bottom left images are MRI scans of an individual with TSC. Now let's focus on the social, health, and economic implications regarding this genetic disorder and its treatment options. So I'm going to elaborate on what I've previously talked about. I'm going to start with health implications and conclusions. Firstly, autistic traits and socialization issues regarding development are the starting point for diagnosing adaptive behavior in neurodevelopment disorders. If you look at the pie chart on the right, you can see that most diagnosis occurs at infancy because that's when autistic traits are generally noticed. They kind of indicate whether an individual may or may not have TSC. Also, around 90% of individuals with tuberous sclerosis complex will have difficulties, yet only about 20% ever receive evaluation and treatment. Renal lesions were observed in 75% of the whole population and 51.5% of patients who are children. Such health implications help us better treat TSC patients and accommodate them with the services they need. For example, therapy for TSC was recently re-evolutionized by oral MTORI because of health implications like the ones I mentioned. Some economic implications we could make about TSC is that it requires a disproportionately high healthcare cost when compared with the general population, particularly in terms of drugs and clinic visits. For example, more frequent and severe seizures contribute to high healthcare costs. The mTOR inhibitor, a treatment option for TSC, was approved by the government in Hong Kong, but was not widely used because of how expensive it was. This economic burden on TSC patients is a significant issue in healthcare systems worldwide. Now let's take a look at the societal implications. TSC patients may have behavioral conditions or psychological challenges like temper tantrums and anxiety, which impacts the way they function in society and socialize. There have been reports of time off work or school, emotional impacts such as depression and feelings of isolation, and cognitive impacts such as delays in speech and slow processing skills. And that concludes our presentation. We hope you learned something new about this genetic disease. Thank you for listening.